The biggest change in healthcare is the movement from the simple words that are used of volume to value, meaning that the way we have historically been paid, we being all of healthcare, historically paid, basically when we provide services, we get paid. So the more procedures, the more surgeries, the more visits, then the more we get paid. And so the shift is that we have to be able to keep people healthy. So instead of waiting until people are sick, people are going to always get injured, so we're going to always take care of people that are injured. But instead of waiting for people to get sick, then basically the push will be to keep people healthy. So healthcare providers are having to do a lot of work to shift towards putting greater focus on management of chronic diseases, keeping medications up, and really some of the same things that we're doing internal to CHI. We have 4 core strategies in CHI that focus on people, quality, stewardship, and growth. The vision and mission statements for CHI both talked about improving the health of communities. We have had our mission and ministry grant fund focused on giving grants to the various ministries that we have across the country to help improve the health of the communities. You all know that about 2 years ago we added violence in society as a specific focus for CHI, so that all of our markets have to demonstrate that they have started an initiative that will reduce violence in their community, and we leave it up to them as to what area they choose. Those are things that we have supported from CHI that go way beyond the walls of acute care hospital. And I'm happy to say that since our founding, this year we topped the $55 million mark. So CHI has awarded grants to improve, for projects that improve the health of our community, in excess of $55 million. These are the 4 priorities: access and coverage for all, which CHI continues to espouse even with the ACA there. Our charitable purpose, fair payment for providers, and then the violence prevention that I mentioned. I think the single biggest indicator around success is not how did the procedure go in the hospital, but actually the discharge meds. If you make investments to help patients to A, get their medications, and then B, to appropriately take their medications, that right there will begin to help with the chronic disease patients, diabetic patients, etc. Going past that, I think the priority will be to make the conversion that I talked about in terms of volume to value, or to quality, or population health, that whole space. It's one thing to say we're going to do it, it's one thing to make a strategic decision that we're going to do it, it's another thing to actually implement and make it happen.